And, oh, I have somebody else in the doorbell. So we'll go ahead and get started. We do have a little presentation to go over the orientation with all of you. And the first slide does talk about introductions. So that's always a good place to start. And then we'll go through the content. And I know, poor Salim, I hope it's not too hot in your car as you're sitting there.
I'm okay.
Are you okay? Okay, good. I'm worried about you.
Yeah.
All right. So I'm Dr. Cheryl Fisher. I'm the, oh, there's Arpad. He's waiting to come in. Dr. Kellerman's one of our faculty. So we'll let him come in and get set up. Hello, Dr. Kellerman. So I'm Dr. Cheryl Fisher. I'm the interim director for the specialty program of nursing informatics. Also faculty. I'm teaching now the capstone course, as we call it, the last course of the semester, as well as helping all of you to find your clinical placements. I came here just in January from the National Institutes of Health in Bethesda, Maryland, where I worked really pretty much my entire career, first as a clinical nurse for the first half, and then the second half working in the informatics field of implementing electronic medical records, working with the staff, training, working at the executive level, to sort of oversee a lot of the programs, working with physician colleagues and so on, having a lot of practical experience. So I'm really happy to be here, and I'll be working with the other faculty and all of you to make sure you're successful in this program. Dr. Van de Kassel, would you like to go next?
Sure. I'm Barbara Van de Kassel, and my background has, let's see, I fell in love with informatics in 1989. And when I was starting as faculty at one of the other universities here in Baltimore, and realized how important this was for nursing to understand. And so I've been on that within informatics and my role in the hospital, and then more recently here full-time at the school. And I do also teach in the DNP program for data management. And I have been a Beacon credential trainer for Epic. So very familiar with electronic health records and how you as nurses interact with them and how we should be interacting with them and pulling data and looking at that. So it's a great way to get excited about nursing in the way that you work and what you can do from that. So welcome, very excited to work with you guys.
Dr. Kellerman, would you want to go next?
Of course. Hi, everyone. I'm Arpad Kellerman, professor of informatics. I have been on the faculty here in the School of Nursing for 14 years already. And before that, I worked at several other universities as a computer scientist, informatician, and also a little bit as a biostatistician. And I got my bachelor's, master's, PhD in computer science. I'm not a nurse. I fell in love with computers in 1982. It was a love at the first sight, and I really wanted to do a career in that, and just couldn't depart from using computers for pretty much everything in my daily life. And I like to be involved, especially in software development. Recently, I have been working on patient education and patient motivation games specifically. And other than that, I did research and published extensively in artificial intelligence and machine learning. And here in the School of Nursing, I am teaching the 736, the knowledge generation in healthcare, 770, the human factors, human-computer interaction, and 785, the healthcare databases.
Thank you, Arpad, and thank you for joining us. Jordan, do you want to go next?
Yeah, sure. My name is Jordan Brockwell. Nursing was a second degree for me. My first degree is in biological chemistry. I went from there to clinical research, went from there into nursing, and now I'm kind of gearing back towards the research part of it. So I've kind of seen data from both sides of it. And that's what gets me really interested in this career field. My bachelor's in science of nursing is from University of Delaware, and I'm currently in Delaware.
Okay.
I'm a labor and delivery nurse. Left that out.
Okay.
Yeah.
Excellent. Well, thank you. Thank you for joining us. Sounds like you're in the right spot. This should be a good fit for you. Salim, do you want to go next?
So my name is Salim Obina. I got my bachelor's degree in nursing in Nigeria. It was a 5-year program, and then I came to the United States in 2018, December, and took my board exams. I passed, and I started practicing in 2019 through 2020. I have a certification in IT, AWS Solutions Architecture. So I'm a solutions architect for AWS. So I'm actually looking at my interest, or when I did the certification program, I fell in love with information technology, and I love data management as well. So I'm actually looking for how to incorporate nursing and IT together, so I could maybe get roles in health IT companies, where HIPAA compliance are really, really important. So that's why I'm pursuing this.
Excellent. Excellent. And sounds like your background is going to make this sort of a breeze for you. I think you will definitely see in every one of your courses how healthcare and IT come together, and the value that you bring to the table is your nursing experience. So that is something I think that is most valuable about nurse informaticians, is that they understand clinical workflow, clinical outcomes, patient care, and so on. So excellent. Thank you for joining us. Let's see, Susan Park. Can you hear us?
Yes. Can you hear
Okay.
me?
Yes, yes. I see you in two places on my screen. One of them says you're trying to connect to audio, but I can hear you.
Okay, yes. I don't know why I'm in two places, but here I am. My name is Susan Park. I currently work at NIH. I am a clinical research nurse on 5 Northwest. It is primarily an endocrine/medical surgical floor. I am interested in nursing informatics when we're currently right now with the nursing documentation. It reflects the acuity, and as well as seeing how the flow goes. So therefore, as a bedside nurse, and sometimes nurses are so busy documenting, but documentation is what we do, and therefore want to see how this nursing informatics can help the nurses at the bedside to lend them a hand and help with the charting. So that's why I am here, to see how nursing informatics go.
Excellent. And we probably worked together for many years and didn't know it.
Yes.
I was in the 2B suite.
Oh, okay.
And just until January, yeah, for a long time. And we probably know have a lot of similar friends. Let's see, Dejini?
No, it's Ginny.
It's just Ginny. Oh, that's easy.
Yeah.
The D is silent. Okay.
So I am an ER nurse, and I'm currently working in a contract in North Carolina right now. So I've always had interest in technology. I also considered being a computer science major when I was in college, but I didn't. I just started taking prerequisites for nursing instead, because I was always interested in patient care. But most recently, I had I think about a year ago, a friend told me about nurse informatics, and I was like, wow, this is perfect. It would just tie both nursing and technology together for me. So I'm very excited to start this program.
Excellent. Well, we're really happy to have you, and thank you for joining us. I'm going to go ahead and share my screen now. So let's see. we'll walk you through a few things here, just as part of your orientation. So I'm assuming that, did all of you do the school orientation? I think it was a self-paced
Yes.
school okay. Okay, and then this is for your specialty group. So, okay, you can see my screen now, according to what I'm seeing. So for those of you in North Carolina and Delaware and all over the place, I will let you know that about half of our informatics students are out of state. So the program is completely online, and then you will do your practicum experience. We'll go through all of that in a place that's convenient to you where you live. So this is in case you don't make it to Baltimore, this is the entrance way. So we're going to start off with, we did introductions. What is nursing informatics? What did the nurse informatics specialist do? A little overview of your plan of study and let you guys ask us some questions. So we went through, I did my introduction. Dr. Nam was the previous, she's on the far right. She was the previous director of the program who has gone on to now be the dean for the PhD program. And then we have Dr. Apoku Ajuman, who is not able to join us today, and Dr. Vanda Castle, who you met and is here. So just in brief, let's go over what is nursing informatics. A lot of people don't understand what it is, but I think you guys kind of hit the nail on the head talking about nursing informatics and nursing and technology and healthcare. And a lot of nurse informaticians also work in healthcare quality, safety, outcomes, and so on. There is a new scope and standards which just came out in June. So that will be something that we will be recommending to you. There are some organizations that are going to find very helpful to help you stay up to date with what's going on. You can look at these websites. There is the AMIA, American Medical Informatics, and then there is a nursing working group within that organization. That's a little bit expensive. It's a little bit physician focused. Then there's the American Nursing Informatics Association, ANIA, which I believe might have a student rate. There's Healthcare Information Management System Society, HIMSS, as they call it, that has local chapters, and that also is a little bit more reasonable to join. And then there's ANIA, which is another one, and we'll again just suggest that you look at these. What these organizations will do is they'll provide you with keep staying up to date with what's going on in the world of informatics. Some of the areas where the nurse informaticians can work: administration, leadership, systems, compliance, consultation. I was considered a nurse consultant in my role at the NIH. Compliance, I think about our safety and quality office. We had nurses in there who were not informaticians, but they were actually working with a lot of data. They were doing the work of a nurse informatician, pulling data, tracking data. We have areas in education and professional development. I think about the training that our Department of Clinical Research Informatics did for the electronic medical record, policy, quality, research, safety, and telehealth and informatics are big areas also that are coming up and becoming very much in need of nurses, especially post-pandemic. Everybody put everything online in terms of access to healthcare, in terms of your portal, and so on. And people were just throwing this stuff up there without a lot of sort of knowledge necessarily of what the patients needed to access their health. Arpad and Barb, if you would like to add anything to that, or certainly add to the conversation, you're very more than welcome to. Is there anything else you can think of? Barb, I know you have particular areas that you're very focused on from your data, and Arpad from his artificial intelligence standpoint? What other things comes to your mind?
Well, I just want to be able to say that you can take informatics into any area of nursing you want and apply it. There's
Agree.
no limit.
Yeah.
It's you making the path, whether it's tied with operations on the unit, in a hospital unit, or in a clinic, or even being innovative with different kinds of technologies with different companies. There's a lot that you can do out there. So these lists are great and it can give you an idea because you're just beginning. But as you work with us through the next few years, you'll be able to see that you're developing skills that you can apply in any area that you're interested in. And that's really what I'd like to make sure you guys are hearing and knowing, that you can do just about anything. Informatics for me is like infection control. You can't go anywhere without it. You can't go anywhere without informatics. So that's all I would like to say.
And I think about our nurses that worked in the OR, for example. They were putting in a documentation system. And so they obviously needed nurses to help design the system. So it was it Celine was talking about the documentation? Somebody was talking about documentation system.
Right.
The EHR, Susan was talking about that, I think, and just how important that is and how it's so ingrained in everything that the nurses do. Arpad, do you want to add to that? What are your thoughts for the
Sure.
informatics nurse?
Yeah, sure. So I would like to mention some of my past students here in the master's program, but also a little bit in the doctorate program who came to me and they had very unique ideas what they wanted to do. And they ended up doing various projects with me. So some of those were in software development. So we developed new software. Some of those were in advanced SQL learning and databases. And with that, she was able to answer clinically important questions that nobody else could answer in her rural hospital because the IT didn't know how to do that. So she learned it and she did it herself. And then also, just coming up with innovative ideas and push the limits, that you see how the current systems work or don't, and then you have something in your head that what if it would be like this? So that could be a starting point for you to just imagine and eventually design and even implement a system. You can start with me and maybe we complete, maybe we don't, but you can take it to next step from there. So you can just first, of course, you put it on your CV, we can publish, we can develop software, we can do conference presentations, and then eventually when you get your job, you can take maybe to the next step and work with your team to go in that direction to develop new software or change the culture of talking points or objectives in your hospital, wherever you are. So you can be at the table and be a leader and a key decision maker, and specifically coming up with new innovative informatics solutions for the scope of problem or scope of work that you are encountering. And I think that's very rewarding to some of my students and for me also as a faculty. And in general, I think this field is going to grow because computers are just going to get stronger and stronger. And as Cheryl mentioned, artificial intelligence is very promising, but it's still not quite there yet. So we have amazing solutions for subfields, but not in a general sense yet. But we're going to see how it gets better and better, and you can be there and advocate, to understand, and even to design, and if you are part of a team, develop as well. And some of our students even learn computer programming, and we have some students who already know computer programming or they finished computer science degree. So they have a really good match, at least to me personally, because then we can go to the next step. But once you graduate from here, you can work in many different areas that wouldn't be available to you as a nurse. You have even a master's degree or doctorate degree, but not much in informatics. You would have an advantage compared to them because you can be part of a EHR vendor or any kind of IT group, software development group, or you can be at the C-suite of the clinical, like CNIO and things like that. And also you can go for policy in government, you can do consultants, and you can go for education as well, like as become a faculty if you go further. So lots of options.
Yes, I agree. I agree completely. Lots of options. We have a nurse that works on our Summer Institute for Nursing Informatics conference team who works for Microsoft. So it is not a lot of nurses that do that, but she clearly was a graduate of our program, has an expertise in nursing, as well as the innovation and the research and development that companies like Microsoft are working in. And so it's fascinating. It really is fascinating. And Dr. Kellerman mentioned there's just so many opportunities, and that's the beauty of this. So we get really excited about it and passionate because we see all the possibilities, and we see our graduates coming out and going on to do great things. And what they do is then they become our preceptors. So we love that too. So just in brief, I'm going to touch upon this. There was a study that was done by HIMSS. I mentioned that organization of 1,300 nurses. They looked at the workplace, their title, their education, training, salary. Their salaries, over half of them were making six figures. And so again, it's a field with a lot of promise and possibilities. And some of the positions that they mentioned, I'll just let you read through here. We talked about them a little bit in terms of the functional roles or titles, but this is what they said in the survey. What this sort of shows you is that there's a broad spectrum. You can be anywhere from the chief nurse to the data analysts to the EHR compliance specialist, quality administrator, telehealth, telemedicine, and so on. There are many roles, titles, and opportunities. Just in brief, most of the nurses in this survey were called nurse informatics specialists. You can see, and then 2017 and 2014 results, but most of them in 2020, or clinical analysts or directors of informatics and so on. You can see some of the titles that they reported, and you can see some of the things that they did, which was systems implementation. And it doesn't have to just be the electronic medical record. It could be implementation of the nurse call system, a nurse scheduling system. These were the kinds of things that we were doing at the NIH, and, you know, putting in all kinds of systems for the nurses. And, you know, a lot of work was going on behind the scenes on this system implementation. And then, of course, there's the opportunity to do systems development. One of the last projects I was working on was a handoff communication system, which was a part of the electronic medical record systems development. I was working with a physician informatician. Quality, project management, and so on are some of the other job roles and titles. And just to point to you, I'm sure you've come across this website several times, but there are lots of resources here that we want to make sure that you're aware of. We are updating the packet for the new students. You probably have come across it already. But basically it just goes over all the different things, helpful tools and tips and resources for you as you are now a graduate student. Just in brief, we'll just touch on this. Now, this is for a part-time plan of study, little example. You can see the green courses here are in our, these are what some of our, these are leadership courses, I believe, or do I have that? Or are they the blue ones? The green ones?
The green ones I thought are core.
The core courses, okay. So health promotion and population, I was gonna say, then the blue ones are the leadership.
Right.
So we have the core, the leadership, and then the yellow courses will be computer applications in nursing, and these are your informatics courses. Systems analysis, healthcare database systems. You'll be learning a lot about database building and development, NI concepts and practice and systems adoption. So 737 and 738 are the capstone courses where you will have the practicum. The practicum is a 4-credit. It's at the end of your program. We will help you find the spot. We actually usually are very familiar with preceptors in your area. We get you settled in. It's about 135 hours, so it's 1 semester. All the nurses that come through this program are working, but usually they will be supported by their organization to participate in the hours that they need for the practicum, or maybe they'll let you flex your schedule. Maybe you can work on some weekends in order to get your clinical in. And the beauty of that is that when you finish, you have some real experience that you put on your CV, so that when you are a graduate of this program, they won't look at you and say you have no experience. A lot of the practicum settings will hire our nurses. That happens a lot. In fact, that happened to me. I had a graduate at NIH who I took as a student and then offered her a job. She worked with us for a while in our nursing education area of the hospital. And then the last thing, Arpad and Barb, I want to give you a chance to add anything, and then we'll talk a little bit about the scholarly paper. So do you want to add anything to this in terms of the plans of study? Do you have any suggestions for?
Yeah, I just want to say that this is only a sample. So yours can be very different from this. You don't have to follow this. So some of our students go faster, some of them go slower, and they don't have to be in this order. There are a few prerequisites and co-requisites, and that's something you have to satisfy. So there is a sequence of what courses you have to take first. But other than that, you can make changes to this one. And in general, you take 738 towards the end of the program, and semester before that you take 737, and also pay attention to the offerings. Many of these courses are only offered once a year, some of them twice a year, some of them 3 times a year. We have spring, fall, and summer semesters. In the summer, you don't have to take classes. In the spring and fall, normally you are expected to take a class, and if you don't, then you apply for a leave of absence, and you can get 2 of those. And there's a total of 5 years for you to complete. So from start to finish, you need to take all these classes, 13 total classes, 40 credits in the total of 5 years.
Yeah, and I would just say that we have started to use a software called DegreeWorks that you can meet your faculty advisor and go through that and map out the entire course of courses for you, your whole curriculum pattern, so that you know what you're taking, and so that when they open up registration, you can go in and register and be done with it and you're set. So reach out to your advisor and we'll work with you with DegreeWorks, which allows you to see the semesters and plan ahead.
Excellent. Good tip. And we're going to talk about that again in a minute, just the resources such as DegreeWorks. So the scholarly paper, so the graduate school does require all master's students to complete a comprehensive exam, but you will not be doing a comprehensive exam. You will be doing what we call a scholarly paper. It is a manuscript. You'll be doing it with a peer, with a colleague. You usually have 2 for each paper. So you have a little bit of time just to think about this and to know that this will be a graduation requirement at the end of your program. And you can see here the purpose of the paper is just to sort of pull all your knowledge together, look at how the interrelationship of the concepts, knowledge and the use. Oh, let's see, we've got somebody else joining us. Knowledge of the research process. It is not a research paper. But you'll be writing about some technology and how it applies to healthcare. And we're also looking at your ability to synthesize materials, synthesize the literature, for example, organize your thoughts. And there's a whole Blackboard website, which gives you lots and lots of details in terms of how to organize the scholarly paper when that time comes. You're also assigned a faculty guide who will help you along the way to make sure that once you completed the paper, that it is acceptable for graduation. We had lots of opportunities to give you feedback and for you to make revisions until it is complete. Okay. And then resources for the students. So academic and financial resources. Oh, we had somebody else come into our waiting room. We have an academic calendar. We have this informatics program does not have a space for electives, but there are additional courses out there if you were so inclined that you wanted to take them. Student handbook, certainly, student forms, and then tools. Blackboard is the platform that we use for teaching. That's where all of our courses are taught, is in the Blackboard site. Dr. Van de Castle was just talking about Degree Works, which is where you will have your plan of study set up. Office 365 we do encourage you and need you to use your University of Maryland email address. And then we have other laptop requirements. It's not required to have a laptop, but might make your life easier, and you can get them in the bookstore if you're, need to be portable or just want to keep everything in one place. It's just a good way to organize. SURFs is for grades, billing, steps, and when you have clinical placements, you will use the it's called exact steps. It's software that will help you to track the hours that you're putting in, as well as for your preceptor to give you feedback and to show your faculty that you've completed your required hours. So lots of things on there that we use to support you. And
I would
yes,
like to add that for the 785 database class, you will also need Windows and Microsoft Access. But
okay.
that might be the only course that requires Windows and Access.
Okay, thank you. And we were just looking at some software for the project management course as well, which is free, where we're going to give you a license key so that you can download this software and use it for project management, for developing projects. Okay, so we had a couple of new people join us. I'm going to stop sharing for a minute. Let's see, we had Tamara and not sure who else. I thought, okay, maybe it was just Tamara that joined us.
Hi.
Hi, Tamara. How are you?
Fine. I'm not in informatics. I'm actually in leadership, but the Zoom hasn't opened. So I just wanted to jump on and get any information that I could. If it's not appropriate, then I will leave.
No, in fact, it's very appropriate because I was a guest speaker this morning in the community health, public health program, and they wanted me to talk about the informatics certificate program, where you can take 19 credits worth of informatics courses. And I was trying to help them see how, anything that you do in nursing, be it leadership, public health, we have clinical research nurses, anything you do, informatics really can build onto that specialty and work its way in. You'll be working in leadership, trust me, a lot with technology. And if it's something that you were interested in learning more about, any of us who are on the faculty can certainly talk to you a little bit more if you're interested. So there's lots of things that you can do with the technology. So I want to just open it up to questions for the group and see what other kinds of things, the idea of orientation is not to scare you. You've already signed up. We're excited about getting started with you. We kind of start you out with some of the basic core courses, and then you work your way into understanding, how technology and informatics fits into this expertise in the field that you're studying, that you're here to learn more about. Any questions so far?
Oh, I have a quick question. So I understand that Dr. Nam is transitioning to the director of the PhD program.
Yes.
For students with her as as a faculty advisor, who will be the replacement for Dr. Nam? A chance.
Let me, is this Susan that's talking?
Yes.
Okay. Let me ask her that question, because several of the students that she has that are completing the program, she is opting to hold on to. So let me ask her that question, because I did notice that you were listed as her advisor, and it may be because maybe you were brought into the program before she was transitioning out. So it probably would either end up being myself or Dr. Nam. So you will have an advisor, and we will let you know that as soon as I talk to her. I'll email her right after this. Thank you. That's a very good question.
Thank you.
Jordan, did you have any questions or?
I did. As far as compliance requirements in Castle Branch, because we only have that one practicum at the end. So is that something we need to be jumping on right away, or what are the expectations for us to get Castle Branch things uploaded?
Barb, can you answer that?
I can just say that all I know is that you should always just get Castle Branch done as soon as you can. Because a lot of times you have to request medical records from a place for vaccines, and it takes forever. And so if you can get Castle Branch done, you should be good. So, and then yeah, you might have like an annual COVID vaccine that you might have to upload, or any of those kinds of things, but I would get as much as you can done as soon as you can.
Okay.
And keep an eye if your nursing license expires, for example, because you're not going into your practicum for, a year or two, and we pass your date, that you get things updated in there as well.
All right. Also, for the practicum, I'm assuming we're required to wear the school uniform, or does that?
No.
No.
A lot of the nurse informaticians that I know that worked in our setting did not wear a uniform at all. Now, I would say that it's pretty much up to your
site.
Yeah,
where
they
you
may
are.
want you to wear a lab coat to identify as a clinical person when you're out on the nursing units, if you're doing that type of work, because our nurse informaticians did a lot of rounding on the units. So they were out talking to the nurses. And so to identify themselves as, a hospital staff, some of them wore lab coats, but again, it wasn't a requirement necessarily. So I would say it depends on your setting, very much so.
I have just one more.
Oh, please.
ExamSoft, is that something that we'll be using often in our courses?
Yes.
Okay. All right. I think that's all my questions.
Okay.
Those were good.
Did you have a problem with ExamSoft, or do you?
No, I've used it in the past. I should have it. I just don't know if how it's going to work switching it to your guys's.
You can still go to the website and download it from here, and it'll acclimate, if you will,
Okay.
to use that word. But it's say, if it's newer, it'll overwrite it. So.
Okay. Good. Thank you.
Okay. Okay. Tamara, did you have any questions for us? Oh, you're on mute.
Tamara, we can't hear you because you're muted. You want to, there you go.
I'm just coming in at the end, so I wouldn't even know really where to start. I still have to complete the online orientation, so hopefully I'll get a lot of information from that as well. And then I'll reach out to my advisor to see if they'll be rescheduling the Zoom meeting that was scheduled for us this evening. But thank you for letting me join.
Oh, sure. We're glad to have you. Okay, Arpad, did you have anything else to add? Any, I know you've been here the longest and you have the words of wisdom from your experience in working all these years with our students.
So you, as incoming students, you need to contact your advisor as soon as possible if you haven't done so already. And they are not going to go after you. Sometimes they may, but normally the expectation is that you as a student reach out to the advisors first. Also do that if you deviate from your plan of study. If you don't follow what we already put into Degreeverse, please let your advisor know. And if you need to go away from the school for a semester, then fill out the leave of absence form. And if you have problems in the course, then of course, first you work with your section instructor of what you can do to get your grade and what options you have, the deadlines for dropping the course. Pay attention to those deadlines, and also deadlines when you can get partial refund for the payment if you want to drop a course. But if you drop all the courses, then that counts as a leave. Then you are not taking any courses. So normally the expectation is that you take one course at least per semester, and that applies to fall and spring semesters. And for summer semesters, you may or may not take classes. We recommend you do, but many students choose not to take classes in the summer. And register for courses early, because sometimes it's difficult to get in and there are multiple sections sometimes, and students may want to take certain section of a course, and that's of course up to you, and that's going to be there in SERFs. And if you have other problems, when the course is not progressing in spite of these efforts, then you reach out to your advisor and see what are your options. And we also have a student aid group at the school, and you can work with them. They may have ideas and possibilities for campus employment or financial aid or whatever paperwork is needed to continue with your studies. And always stay in touch with your advisor and just do your best, and don't take more courses than what you can handle, but also don't wait until the last minute. Okay, so good luck to you, and happy to see all of you today.
Great. Thank you, Arpad. Let me just give you one last closing thought. We are in the process of putting together a collaboration site for all of you to get to chat with each other, pull in some of the resources that we think are important from the website, as well as the nursing informatics field. We like to keep you up to date with, what are the hot topics, what are they talking about, and we are members of most of these organizations, so we do go to the conferences, and we don't expect you to be members of all of them, but to try to just help you keep up, and we keep you up through your classes too. What's the best way to know kind of what's going on in the field? What are they talking about? We're talking now a lot about diversity and equity in the field of informatics and access to technology and things like that. And how do you keep up with knowing what is the focus? What are the things that we should be listening and paying attention to? When you get into the literature, you can get overwhelmed, and you're going to be very busy working students, and we understand that. So I think this little collaboration site will help you to sort of know what are the things that that we as faculty think are important for you to know. So as well as for you to chat with each other. It's not really for advising, but it's really a site for you that we're putting together. So it's not finished yet. It's in development, but we'll have that out. We'll be sending links out to you to watch that in your email. So, okay. All right. Well, if there's no other questions, we're going to let you go a little bit early. And again, if any of you have any questions, thank you all for coming. I think that's all I have for now. Okay. All right. Thank you all.
Thank you.
Thank you.
We'll see you in classes.
All right. Have a good evening.
You too.